My name is Joshua Park. I'm the CEO of Biomedical, and we are building Blink, the first in the world of continuous eye health monitoring. So we're seeking $1 million in a convertible note with 10% interest, and we can get into that a little bit later. So in 2019, we were sitting down with what is now our medical advisory board, and we were trying to understand, why are people still going blind? What is the big issue that optometrists and ophthalmologists are facing? So what we realized is they were saying the real issue that they were having was not being able to understand what's happening to the patient outside of the office. So we thought to ourselves, okay, what could we do with this, right? They need more data. And so we looked at companies like Dexcom that are doing continuous glucose monitoring. And for them, we realized that the more data that you give a doctor, the more that they can tailor treatment for the individual patient. So we were looking at kiosk versions, we were looking at different devices that they could take home, and eventually we realized that most of the patients were already wearing a wearable device, and that was their glasses. And so for the last 4 years, we've made our vision technology invisible and embedded it into glasses, which I'm wearing right now. They have cameras embedded into the frames, 16 hours of battery life, Wi-Fi, Bluetooth, accelerometers, temperature humidity sensors, notifications for the patient. All of that data is collected every single day, about 5,000 images. And then at night, we stream off that data to our servers so that the doctors can understand what's happening to the patient outside of the office. So the first two markets that we're hitting are amblyopia and myopia in this Q4 of 2023. Amblyopia is a very interesting disease in the pediatric space and pediatric ophthalmology because the key to it is patching. It's a completely curable disease that 2% of children have in the world. And yet, you can cure it if you will patch the dominant eye. But doctors don't know if the child is actually in compliance for the 6 months, a year, 2 years that they're requiring them to patch. And obviously, they rely on surveys, which we know are very inconsistent. Children hop on the school bus as a 6 or 7-year-old, and the first thing they do is rip that patch off and throw it out the window. Right? And then they tell mom and dad, oh, no, I worked for 4 hours today. I promise, I also didn't steal the candy. And so this issue comes into play 12 months down the road. There's a short window of time that we can attack this disease, 4 to 8 years old for children. So if they waste 12 months ripping their patch off and throwing it out the window, the doctor all of a sudden doesn't know, is it actually the treatment plan that I have them on, or is it that they're lying on the surveys? And even then, the parents will lie on behalf of the child because they don't want to look like a bad parent. So what we do with our tech is because we have cameras built in, we can understand down to the minute how much patch time the child is having on a daily, weekly, monthly status. So then the doctor can call the patient month 1 and say, hey, what's going on? I thought we were going to patch this kid for 2 hours a day. You're averaging 45 minutes. If you want to cure their disease, we need to do it quickly. The next disease that we're focusing on is myopia. It's had a 30% increase year over year since 2020 because kids are spending far too much time in front of a screen and far too little time outdoors. And that ratio is really important. So that ratio, doctors know that if you spend, for every hour you spend outside, you're 17% less likely to develop myopia. And so we're marketing this specifically to children that have early onset myopia, and the parents are wanting to get in front of the disease before it gets far worse. So these are not the only two diseases. Obviously, we're building this healthcare platform. There's over 30 different diseases that we are able to track just by looking at the eye. But these are the first two because they're time sensitive and they're very much low-hanging fruit for us. And you can see the market for just these two diseases is a $5.7 billion TAM going down to a $100 million SOM. And this is just for amblyopia and myopia in the pediatric market, right? And so we've also worked over the last 4 years to develop multiple different patents with our partners at Kenobi Martins here in Irvine, kind of a pillar of excellence in the ophthalmic space. And so from glaucoma to dry eye, from blink rate to myopia management, screen time, and many, many more that are pending. We've also worked with the FDA over the last 12 months, and we're very happy to announce that we are about 1 month away from FDA clearance as a 510(k) Class 2 exempt device. And so now we'll be able to put that stamp of approval on our device so that doctors understand the quality of care that we are providing to their patients. From our business model for the pediatric space specifically, next year as we go into the adult space, we're going to be doing B2C, but initially we're doing B2B2C. And this is specific because then the optometrist and the ophthalmologist get involved with the patient early on. And this is really crucial if we want to improve patient outcomes, right? We want them to be connected more often, and then it gives the optometrist and the ophthalmologist an opportunity to either rent the device to the patient if it's a short-term disease that they're looking to monitor, or sell it outright to the patient if it's something that they're wanting to monitor in a more longitudinal fashion. And then that patient gets the device shipped directly to their home, and then they pay a subscription fee basically to monitor the data, which then is recurring revenue for us as well as for the doctor. Standard go-to-market strategy, lots of conferences, lots of KOLs, as you'll see when we get to our medical advisory slide, and also doing lots of research at Baylor, UCI, Mayo Clinic, Western University. We're in a very specific class because for us, we collect so much data for the doctor, hundreds of thousands of data points every single day on their patient, that we have very much a clinically meaningful data set for them to look at, whether it's a day, a week, a month, or a year out. But then we also have the ease of use that's similar to other smart frame technology, which is grab your frames in the morning and wear them all day. That's all you have to do. Our battery life lasts for over 16 hours, so you can just wear your frames, and that's all the doctor has to tell the patient. You can see our team, and I'm just going to point out our Chief Medical Officer, who we brought on this last year, Dr. Rehan Ahmed, board-certified ophthalmologist out of Baylor, also has his MBA from MIT. To our clinical team, we have, I will point out, Dr. Arthur Sitt. He's the chair of ophthalmology at Mayo. He's been connected with us from the very beginning. He's very much a proponent for telehealth, understanding what's happening to patients, and he's doing all of our glaucoma research. And then, of course, doctors at UCI, Baylor, Western University, and a few more. To our exit strategy of looking at whether it's pharmaceutical companies wanting to decrease the cost of their clinical trials, optical retail companies wanting to get into tech, health plans wanting to do telehealth, or tech companies wanting to get into the health sector, we see each of them as potential acquisition opportunities. And then finally, our use of funds. So raising the $1 million, we're doing continued development. We're finishing up in our manufacturing, which we're doing up in Spokane, and also getting into a couple different neurobiomarkers at Baylor that we're very excited about. So in summary, we're a data-driven company. We have tons of different biomarkers. Like I said, over 30 different diseases that we're able to look at just in the periocular region, the region around the eye. And we are about 1 month away from being FDA cleared as a 510(k) medical device. Thank you very much.